Hello, my name is Rajesh Arakal. I'm one of the spine surgeons here at Texas Back Institute, and today I'd like to speak to you about sacroiliac pain, which is a very common source of discomfort when people have lower back pain. The sacroiliac joints are the large joints. They're one of the largest joints in the body, and they are right where the spine and the pelvis meet. And so from a load-bearing surface, it is all of the stress that goes and transfers from the hip joint as they go up the pelvic area gets transferred through the sacroiliac joint area. So when people can have discomfort, sometimes it may be just from having a stubbed toe or knee pain or knee arthritis, and they walk a little bit offset. They walk with a limp, and that can be a source where the different stresses or the loads on the pelvis can cause them to have pain in the sacroiliac joint. So I'm going to turn this model, and if we look at this in the backside, a lot of times when people describe pain, they kind of describe it really low down. So just right around where the spine and the pelvic meet, so right in these areas. So sometimes it'll be very focal pain. And in fact, some of the most diagnostic findings, if they say, I can point it right here, and they put their finger right there. So it's right at the junction where the sacrum and the pelvis meet. So, from a perspective of diagnosis, people do a really good job nowadays of trying to see, is it a disc problem? Is it a joint problem? And they get MRIs of the lower back. And sometimes we come back and these MRIs look completely normal, and people have miserable pain. They're having a hard time standing, they're having a hard time getting up from a seated position, and their hips are okay, and they're able to move through the hip joints themselves okay. So sometimes it can be isolated sacroiliac pain. Sometimes we see that in women, people who have had multiple pregnancies or difficult pregnancies with large babies, sometimes at the end of the term or right around childbirth, they'll have sacroiliac pain, and sometimes that can be a recurring source of discomfort. In regards to how we manage it, I think ultimately it comes down to having a good history as well as getting a good physical exam. So sacroiliac issues are diagnosed with certain tests. Sometimes, as I mentioned, it's helpful to know where the pain is. So if the pain is really coming right from that one joint area, you can isolate it to that area. You can stress the joint. And so sometimes what we ask is we ask people to either be in a seated position and then cross their legs. It's called a figure 4 test. And if by doing that it causes very discrete pain right at the back end, right in these two joint areas, that's one way to see if the pain is coming from that area. Sometimes there are other specific tests that if you're laying down on your belly and you try to bring your leg back, it causes pain, or sometimes you'll have an examiner stress the joint while doing that maneuver, and that can cause pain localized to that area. There are different ways if the pain is coming from the SI joint, and if you look at generic ways to treat it, oftentimes anti-inflammatories are a good way to start, and stretching programs. So a lot of times it's actually simple measures. Sometimes you can do topical creams or treatments like over the counter you can get capsaicin creams or Voltaren gels to kind of bring down the topical sensation, as well as anti-inflammatories to help bring down the inflammation. If those things don't work, then you can do more invasive treatments, invasive in the sense of needing somebody to put a needle in under x-ray, so sometimes you can do focal injections to that area. Sometimes they can be done in the office with an ultrasound. Some of our pain management physicians or physiatrists will do that. Sometimes it's done in a surgical suite where they have a C-arm where they can kind of localize and make sure that the needle is targeted right to the joint. If those treatments are short-lived and if they still need further treatment, sometimes our pain management physicians or physiatrists will do things called radiofrequency ablation or rhizotomy treatments for that. If those things are limited or they still don't work, then there are, as a case of last resort, surgical treatment. So sometimes I get involved in cases where people have tried these and they still have discomfort, and that's when we go in, and there are treatments that can actually stabilize the sacroiliac joint. There are sacroiliac fusion type options that have been, that have changed a lot in recent years, and so sometimes with the changes in the technology, not only has it gotten a little bit safer, but it's gotten more reproducible and reliable when we do treat them, that they get better with it. There has been a lot of debate among spine surgeons when people get big scoliosis type surgeries. In the past, we used to stop it at the sacrum, and people were having a lot of stress in the joints, and so people would have a lot of sacroiliac pain. So that's also a source of discussion within the spine community, because maybe about 20% or more of people who had fusion type surgeries will have some discomfort in this area. And so when people talk about why people have residual pain, part of what we try to do is be good about diagnosing if there are treatable sources and address it, because we find that if it is treated appropriately, people can do quite well with it. When should someone come in with sacroiliac pain? I think, like I said, sometimes doctors have a hard time knowing it's sacroiliac pain. So as a patient, I would say anytime that if you have pain that isn't responding to simple treatments, anti-inflammatories and stretching programs, and it's still kind of an annoying pain that's lingering, or if it's very debilitating, obviously we want to be able to see you and examine you. My name is Dr. Arakal. I'm one of the surgeons at Texas Back Institute. If this issue is bothering you, please feel free to reach out to the Texas Back Institute. We are happy to treat and evaluate you and make sure that this condition can be made better.